Why is it important to learn landmarks that can be used to locate MSK structures on ultrasound? Some musculoskeletal anatomical structures may be challenging to recognize, such as nerves. Others may be difficult to isolate from the surrounding structures, such as muscles. It's important to learn relevant landmarks to assist you with the structure recognition and proper transducer placement. I'll show you an example of two structures that may be difficult to locate in the posterior hip and how you can use landmarks to improve your scanning ability. The first is the piriformis muscle, which you may need to locate to perform ultrasound-guided steroid injections for piriformis syndrome. If you're familiar with performing MSK ultrasound of the hip, you can use the ischial tuberosity, where the hamstrings insert, and the greater trochanter, where the gluteal tendons insert, as your landmarks. If you place your transducer in a transverse plane over the posterolateral lower buttocks, the piriformis can be visualized as a muscle with horizontal fibers running between the ischial tuberosity and the greater trochanter. It is the most superficial of the external rotator muscles, lying deep to the subcutaneous fat and gluteus maximus muscle, which overlies the entire buttocks. Once you get comfortable locating the piriformis muscle, you can use it as your landmark for locating the sciatic nerve as it emerges from the piriformis muscle in the posterior hip and becomes visible on ultrasound. This is also a common site to perform perineural steroid injections of the sciatic nerve because it cannot be visualized at the level of the spine on ultrasound. You should also begin a diagnostic evaluation of the sciatic nerve at this level and follow it in the short and long axis from proximal to distal in the posterior thigh when a peripheral nerve ultrasound is requested. The piriformis muscle and the sciatic nerve can be imaged using either a high-frequency curved or a high-frequency linear transducer, depending on the patient. Just do what you think looks best. Hope this helps.